all our eminent participants for accepting our invitations to be part of the Advisory Council of NDMC and for taking time out from your very busy schedules to attend this meeting. So today with me, as you know, I have my co-principal investigator, Professor Ganesh Ramakrishnan. He is a professor in the Computer Science Department at IIT Bombay and also PIC of the Quetta Center for Digital Health at IIT Bombay. We also have Dr. Sharbani Belur, who is the Secretariat Head of NDMC, and our project manager, Ms. Sandhya Hariharan with us. Professor Shubhashish Chaudhary, Director IIT Bombay, who is also the convener of this advisory council. He will join us at 3:30 p.m. Our apologies for the delay. So we will start the meeting as we have just now received information that chair will leave at 3:30. So we will try to go over the overview slide very quickly and go to the main points. So the main goal of this consortium is to support Government of India initiatives for disease control and elimination, particularly infectious diseases, by doing disease modeling based on national and subnational data for at least 5 diseases in 1 year. So the consortium was set up in 2022, and this is anchored at IIT Bombay, which is an institute of eminence. And the main objectives are to build an institutional nucleus for the country's disease modeling ecosystem, to generate disease burden and impact estimates, both at the national, subnational, and district level, and to guide disease interventions in focus geographies. So next slide is our agenda slide. So we will quickly go to the important point where we would like to request guidance on policy and programmatic questions and understand how we'll be able to access data for disease modeling and which methods we are going to use for dissemination of our models or modeling outputs. So first we will go to that slide. This is a brief slide on the organization structure. Okay, so this is the most important slide. So we are jumping to this slide. So in this first meeting, we are trying to identify key policy and programmatic questions which will be addressed by modeling. By modeling, I mean by epidemiological models, mathematical models, and statistical models. To do this, IIT Bombay will work with the concerned departments or institutions to generate problem statements and co-create solutions. We also plan to place a consultant from our group in NHM who will coordinate the asks from the different departments and ensure flow of information. For this, we request a central memo from the chair of Advisory Council to all concerned departments to facilitate this process. So this is the most important point. And as you know, since we are going to do disease modeling, we will be requiring data, that is programmatic data, disease blind list, coverage data, etc., from relevant departments. So NDMC wants to sign non-disclosure agreements as required for exchange of this data with all the involved departments and institutions. For this also, we request a mandate from the chair of the Advisory Council to enable timely data sharing process. So this is the most important point.
Just to add to what Professor Sivali said, we have had in the past a lot of need asked from centers such as the Center TB Division, CTD. The additional DG, they gave us multiple problems on TB. But in the absence of an NDA, we are not able to move ahead. Right? We would like more details, for example, on the India TB model and access to data. And there's basically a need for an integrated approach, even in terms of sourcing data. We have other examples. We had a siloed success where we got some data from the Mumbai Municipal Corporation for measles. But now when we go back to them for larger TB data, again, a mandate from the top would be really helpful. So this is just to strengthen the point that Professor Sivali Mukhopadhyay made, how mandate from the chair would really make a big difference.
Okay, so can I respond?
Yes, please.
Right. So there are a few points that it will be good if we remember going ahead. The first point is that the entire exercise of this consortium visualizes that we would be using disease modeling to estimate disease burden of priority diseases in the country. So that is a given. Why are we doing this consortium? So that we bring not only existing modelers at one platform, but also create an ecosystem. Why do we bring them at one platform and create an ecosystem? So that we can, I think someone has kept their mic on, so I am getting an echo. Can it be switched off, please? Okay, so I was saying that, thank you. So I was saying that why are we doing this exercise? We are doing this exercise that the existing universe of disease modelers, which itself is a very limited universe, are brought on one platform. And within the country, that is most important, within the country, we create an ecosystem for disease modelers to thrive. So why do we want this thriving within our country and bringing these skill sets onto one platform so that we can estimate the burden of diseases? And why do we want to estimate the burden of diseases? So that we feed into policy and we feed into implementation strategies. So these are three givens. Within this, we should also not lose sight of the fact that even if we do not consciously do it, although in this case we have consciously done it, you will find that in different thematic areas, you will have international people, you will have international institutions. So if that is also a given, therefore it is important that data which is shared by user departments within Government of India is anonymized data. No line listing can be shared. That is also a given. So there should not be discussions on this point. Why is it that I'm not getting a list saying Ramdas, son of Shamdas, resident of, XYZ colony? So that cannot be given because there are issues of data privacy, data protection. So anonymized data, yes, can be used, must be used. Other important issue is that the intellectual property right or IPR in respect of any model that is developed would reside within the consortium and cannot be shared with any international organization without the specific consent of NDMC. That should also be a given, and we should not be debating on that, because if we start debating that, then things probably will not proceed ahead. Placement of a consultant in National Health Mission, a very welcome step, should be done in the quickest possible time. Issuance of an advisory from Secretary Health and Family Welfare, Government of India, again is necessary, must be done, but we must realize that the target group of this advisory is very sort of tightly defined group. Within the Government of India, it would involve Department of Health Research, Department of Biotechnology, Ministry of Women and Child Development, and maybe a couple more ministries. That is it. That advisory is not going to every ABC entity in Government of India. It will go to all state health departments because they are also repository of data, and they would also form the universe of the beneficiaries who would eventually benefit from any disease model which would, help them in refining their implementation strategies. So therefore, advisory is yes, we will do that. I think these three sub points which are there on this slide, I have addressed. Thank you.
Thank you very much. Yes, all the points which we showed were addressed. We understand all the concerns expressed and we agree with all of them. Thank you very much.
Just to substantiate your points, sir, all the institutes for partnership that we have proposed are all within India, and they're also geographically well spaced. This is as per suggestions from the DG ICMR, who's unfortunately not here, but he suggested that we have fair representation. So that will also make sure that we have representation across states.
For dissemination of our modeling outputs.
Professor Ganesh, that point is very well taken. My only suggestion was, and I'm not against even having people from outside. I'm saying people from outside can collaborate, but they are collaborating because we think that they bring some added value to the table. Otherwise, we don't want them just because, they represent an institution situated outside India. Similarly, we are saying that if such an institution situated outside India is collaborating with us, the IPR resides with us. It doesn't go to them. So that should also be clear, because when we say we are creating an ecosystem, the idea is to strengthen and create a skill set, a knowledge set, a professional set within the country that is sort of dispersed geographically across the country in different institutions. And there was one minor point, I'm sorry, that I could not address, which is about non-disclosure. Within the Government of India, we do have multi-stakeholder institutions where this non-disclosure template is followed. For example, I was discussing with the Secretary DBT, Dr. Rajesh Gokhale. There is an entity called NTAGI, the National Technical Advisory Group on Immunization. It is a multi-stakeholder body, and it consists of institutions outside the government also. And there is a template of non-disclosure that they follow there. So it's a wheel which has been invented. We can, if everyone agrees, adopt the same template for our business also. However, I would be more than willing to listen to what Dr. Gokhale may have to contribute on these issues. Dr. Gokhale, would you want to say something?
I think Secretary Health has already provided clear updates on it. Actually, I think NTAGI has a very good model of non-disclosure that we all follow and have been working for several years now. I think therefore it's a good template to follow up on. Actually, I think the data sharing policy, till the time it is within India, there are some, it's okay. You can manage and clear data with, it can be tagged as well. I think when you even these days even give models as well, when you share models as well, the data gets tagged with it as well, models as well, right? Actually, and that's one of the problem that you need to figure out how to get rid of that, because see, one of the problem with AI-based modeling and all actually is that even if you give AI-based model, the model itself has the data attached with it actually. So people are figuring out ways of extracting data from there and be able to utilize. So I think we should be a little bit careful about all these things. Otherwise, I think it's a good opportunity for us to strengthen our ecosystem and be able to bring together various stakeholders to be able to carry out, something that is completely not fully functional in our country right now. Thank you.
Dr. Kotwal, would you want to say something?
Sir, good afternoon, sir. Thank you for this opportunity, sir. So I fully agree, endorse what you recently just now said, sir, about the non-disclosure as well as also the anonymized data. And so along with the disease burden, sir, they should also look at the predictive modeling also, the model in its entirety. Like for TB, it's been mentioned. So by 2025, if we are doing currently what we are doing, if we keep on doing the same, we'll be able to achieve the goal or not? Or do we need some changes? That kind of modeling also should be built into the entire modeling framework as such, sir. So we should go beyond the burden about the predictive explanatory as well as predictive modeling. And just two more, sir, requests, sir. One is if NHRC could also be added as one of the institutions, because during COVID, we analyzed the COVID models and came up with a review, and even mortality, sir. Our paper is about to get published. We have reviewed all the mortality models which were created by various people, and the kind of, the flaws which we found regarding the data assumptions and interpolation. So this consortium, I think, sir, it's a great initiative by you, sir, that we must follow the scientific rigor in the models as such to make them useful, especially for the diseases in which we need focus right now. And also in the list, if you could add the emerging, re-emerging, and also any disease coming up for a any pandemic kind of potential as such. So I'll stop here, sir. Thank you, sir.
Thank you, Dr. Kotwal. So back to you, Professor Shuli and Professor Ganesh.
Yes, thank you. Thank you for all the comments. Dr. Kotwal, we are going to look and already are looking at predictive modeling of diseases. We'll be looking at emerging, re-emerging diseases, infectious diseases. If there is a need, we will also look at zoonotic diseases. If there is a need from the government of India, also at non-communicable diseases. So whatever is the need, we will address it through this consortium.
Also to address an important concern brought out by Dr. Rajesh Gokhale, that no matter what we do to anonymize with AI models, the privacy preserving part can be a little bit more challenging. And Dr. Gokhale will also keep that in mind. There have been a lot of work on fair AI, and we have in fact a center for trust. I mean, basically trust and fair learning at IIT Bombay. So we'll make best use of state of the art to ensure that even if it's AI models, there is privacy preserving learning as far as possible. With your permission, can we proceed if this is acceptable?
Proceed.
Yes. So to disseminate our outputs of the consortium, we will share findings through proper channels for programmatic discussions, feedback, and actions. We will generate appropriate knowledge products, and those are listed as per government requirements. Since our students, particularly our PhD students and postdoctoral students, will help us in this research, we would request that we would like to publish some of the key outputs in peer-reviewed journals and conference proceedings with due acknowledgements and co-authorship of the relevant government functionaries. This is particularly needed since we are an academic institutions and our students will be supporting us in our research.
And we speak this representing all the other academic institutions in the consortium.
So this is perfectly fine as long as we curb the tendency of proactively disseminating it in the media. Everything else is fine. When I say media, it means, print and electronic media, newspapers, electronic channels, because at times when a particular model or a finding of a particular model is under discussion with the ministry and the consortium or is being peer reviewed, the tendency to share with this popular media, print and electronic or even social media, creates a lot of wrong narrative, which would then impact the progress of use of findings of such modeling.
So to address this concern, we have articulated some terms of references for all our investigators in IIT Bombay and also the partner modelers. And in those terms of references, we can send to your office also. It is clearly outlined that nothing can go to the media. Like as you said, when it's still in discussion or in the peer review mode. So we have put that. This is the further, yeah. So we have put that specifically.
And this was already circulated to everyone.
For partners.
For partners also we have similar terms of reference.
So my minor suggestion would be that if the TOR could be shared with Dr. Rajesh Gokhale, Dr. Rajiv Behel, and also Director General Health Services, Dr. Atul Goyal.
We will certainly do that, and we will also highlight the parts where we have mentioned these concerns in the TOR. Thank you.
Okay, I saw Dr. Kotwal's hand. You wanted to say something?
Sir, no, it was covered by you also, as well as the TOR, which I saw just now, sir. Just wanted to highlight that during COVID, non-peer-reviewed models published, even in scientific journals also, did more harm than good for the, the reputation of the mathematical models. So peer review is a must, and publication only after the peer review process and due approvals also. Just want to highlight that, sir. Thank you, sir.
And thankfully, systems like IIT settle for nothing less than peer reviewed. So we'll maintain that standard, and that will be documented even in our NDMC. Thank you for that valuable input.
I just have, with the permission, sir, just one more point that the TOR for the partner institution should be clear and they should be conveyed, because I saw some, private institutions, and so their somehow track record in last 2-3 years of publishing before peer review and approval. So that is well known to all of us. So that could be, that could be some kind of MOU and NDA and all, as rightly mentioned by Secretary Sir, should be signed by all of them. To have us as a safeguard as such.
So the partner institutions, these are proposed partner institutions, and we are proposing them. Advisory Council can tell us if they would want any changes. Most welcome, any suggestions. Also, along with the TOR, we are also going to send the MOU and the NDA to all the partners and modelers.
So are there any other issues? Because I have another meeting at the minister's chairing.
Yes, so we would also like to show so here we are dealing with infectious diseases, and we have quite a few infectious diseases which we have divided up into 4 disease groups: malaria, tuberculosis, vaccine preventable disease, and neglected tropical disease. And for each of these disease groups, we would like to propose advisory groups. So there are 4 advisory groups, and the members are listed here. So Professor Ganesh will lead this discussion of disease groups. We would like to get your suggestions on the members we have listed here.
So for each advisory group, we have structured a proposal where the chair is typically director of some prominent research institution. For example, chair in the malaria case is director of National Institute of Malaria Research. A co-chair would typically be a joint director. That's how we identified, in again from an aligned institution. Convener and co-conveners in all cases are currently from IIT Bombay. Going forward, we could have these also from partner institutions. And we have listed several members here. Some of them could be from partner institutions, some of them from international institutes of repute who have worked. As the chair pointed out, we are happy as long as they enrich and enhance our knowledge and our functioning. So if instead of going them line by line, if you have any specific suggestions, please let us know. For malaria and tuberculosis, we are projected to begin with. These will meet at a higher frequency. I'm assuming that the advisory council here will meet at best once in 6 months, and the worst case once in a year. But these will meet very frequently to actually activate the process of modeling and data collection. So therefore, your due diligence here will be very useful.
What we will do is that we will permit maybe a week to 10 days time to all the members of the advisory group to comment on this proposed composition of these four disease specific advisory groups, and they can email it to the secretariat of NDMC, and we can then proceed ahead.
Thank you. We'll do that right after today's meeting in the minutes.
So one more important point remains is that we had sent a term of references for advisory council members with our invitation emails and also the email sent yesterday. So we wanted to ratify that TOR which we have sent.
That
So
was
the
the last
same
pending.
So the same timeline applies to that, because I am not aware that either Dr. Rajiv Behel or Dr. Rajesh Gokhale have had time to go through those proposed TORs. So we provide a week to 10 days time. We can even fix a cutoff date and say that by such and such date, electronically suggestions can be shared.
Sure.
Thank you.
Thank you.
Yeah.
That's very helpful. In our personal meetings with
In the initial period, we may have to meet more often than maybe once in every 6 months. For example, the second meeting, we may have to convene sometime in the, say, second week of May, so that whatever we have decided today, we could do a quick update of where we have proceeded as follow-up action.
Thank you very much. That is very welcome. We will work with your office on that date. So there's one last pending item, which is on the organizational structure of NDMC itself. We have discussed everything. Now, what happened is when I had met you personally, we had sought your opinion, and also your inputs were reflected to reconstitute the advisory council members here. So the ones at the top have all accepted. Thanks to Dr. Atul Kotwal for his presence here. We have had some who have declined and one is pending. We are proposing, if we, for fairer representation also across genders, if we can have Dr. Soumya Swaminathan in her new role as the chairperson of MS Swaminathan Research Foundation, if she could be part of the advisory council.
It's a very good suggestion.
Thank you. We'll take it as a go ahead from you then.
Of course.
Thank you.
Thank you.
That was very helpful.
Yeah. I think we have addressed all the important points.
So let us quickly circulate the record of discussion of today's meeting and schedule a subsequent meeting in the second week of May.
We will do that, sir. And we will also communicate to our director, who's the convener. He said he'll join at 3:30. He may be here in any minute. He had scheduled to be available at 3 p.m., but now he had another meeting. So we'll communicate to him whenever he comes.
Please do. Yeah, please do. And I'm sorry for a bit of a messy meeting today, but ministers' meeting also takes precedence. So therefore, hopefully our second meeting would be more comprehensive and would have sufficient time. Thank you all.
Thank you.
Okay. So people in the room have nothing else to add?
Well, nothing much. I think the contours of how modeling can be done, maybe we can discuss in the next part of the meeting actually as well. Some of the important aspects of what are the kind of key factors, where is the need, what kind of activities are required.
Thank you. Thank you very much, Dr. Gokhale.
Okay.
We'll also see you on coming Monday. Dr.
Yeah,
Rajesh Gokhale will be a chief guest for our center inauguration. So see you there,
Okay.
Dr. Goge. Thank you.
Okay.
Thank
Thank
you.
you.
Bye.
Thank you.
Thank you very much. Thank you.
Thank you, sir.